I'm Ryan Wood. This is my NG tube insertion, medication administration, and NG tube removal video. So to first start off the procedure, I would provide patient privacy, introduce myself to the patient, explain to them what's going to happen, get their name and date of birth, and as well as following the orders of the procedure. And I would talk to the patient, explaining to them, asking them their history, if they've had any history, nasal history with like a deviated septum or certain symptoms that could affect the tube going down into the nares, into the gastric area. So first I would look at the nares, just like I said, looking for a deviated septum, and looking for the patency of the nares. So I'd ask the patient to grab their finger and push on one side of their nostrils and to breathe, and as well as the other side to see how well they are breathing, and as well as looking for a gag reflex prior to putting in the NG tube. So I would put this tube in and see the patient's gag reflex is intact. So then I would get the NG tube ready and measure the tube placement. So I've measured from the tip of the nose to the back of the earlobe, the lower earlobe, and then the lower earlobe to the xiphoid process. And then I would measure the distance where that measurement would be. Alright, I get my water ready and lube approximately 4 inches of the NG tube. I'd have the patient tip their head back for patent nares, and then hover in their neck and tell them to take a deep breath and insert. And as I go past, the patient could feel irritated, and I would, as I get hit towards the oropharynx, I can start rotating the tube towards the opposite nare, and the patient, once I hit the oropharynx, then I can, the patient, have them tilt their chin to their chest and take sips of water, and each time they sip water, I would insert the tube even farther, continuing to rotate the tube approximately 180 degrees. So now that I have the tube inserted, I can temporarily attach it to the patient's cheek, and then I would check the placement of the tube. So to check the placement of the tube, you can do 3 things. First, the guaranteed best way to check the placement is for an X-ray. And then the second thing I can do is instill 10 to 30 mils of air into the NG tube and listening for a swooshing sound as I instill it. So I'll push the air in, and I'll hear that swooshing sound to where I put the for proper placement. And then after that, I could remove gastric contents, just a few, and then get a pH testing strip and putting it on the strip, and then comparing it to the pH of what it should be. It should be very acidic, has gastric contents, and then the rest of the gastric contents I can instill back into the stomach, so it won't affect electrolyte balance and acidity. So now that I know the tube is in the proper placement, I can tape the tubing to the patient's nares, going under and then over on the opposite side, as well as doing the same on the other nostril, going over and under. And in case there was a tube misplacement, if the patient would move their head or anything, I'm going to put a flag on the patient's on the tubing in case so that way I would know if the tube had moved or not. So it would be a simple flag putting the tape together. And then I would get a safety pin and securing the tube to the patient's gown. So anyway, so next would be next would be the medication administration. So before doing that, I would get the medications, the correct order, verifying the right route, the right dose, and that they can be inserted through an NG tube, and verifying the patient's name and date of birth. And first I would put the tube into this crusher. Crushing it. And then once it is crushed properly, I can put it in a container or a cup, and putting 10 to 20 mils, or 20 to 30 mils into this cup, and letting the cup dissolve, and then doing the next one with the other two. Doing it in two separate containers, making sure that they are both dissolving with 10 to 20 mils of water. Prior to doing this, I would grab the tube and then flush it with 20 mils of water. Make sure that the tubing is patent. Remove it and get my medications. My first medication. Getting all the medication. And then instilling the medication. Removing it. And then flushing it again with 20 mils of water. Then I would do it, since I just flushed it, I would get my second medication. Instilling it. And then flushing it again with 20 mils of water. So that is the administration of medication through an NG tube, and then next would be removing the NG tube. So I'd make sure that verify the orders with the physician that these are the correct orders, and assess any drainage or leakage in the patient's around his nose or anything if there's any irritation. And then again, before I would remove the tube, I would instill approximately 10 to 20 mils of water to make sure it is patent before removing the NG tube. So I instill the water, and then I can remove the tape. Tell the patient to take a deep breath and remove it smoothly and quickly so there's no irritation. And then just quickly remove it. And then I can wipe away any leakage or drainage on the patient's nose and document the procedure.